Hi, this is Ruth Brenner, and I have the pleasure today of interviewing Dr. Rob Bradley. The date is 9/26/24, and he's going to talk about his time when he came to Windsor as a doctor in 1977, right?
Right. And what really brought me to Windsor was I wanted to be a country doctor, and I wanted to come to Windsor because it was a small town surrounded by farms. How did I get to that point? Well, I graduated from medical school in 1972, did a rotating internship back in New York State, went into the Indian Health Service at the end of the Vietnam War as a military volunteer. I was in the Indian Health Service working on the Navajo Reservation for 2 years, and then came back and finished a family practice residency in Greeley. Then I was ready to move into private practice. Windsor looked like a good opportunity because, again, small town surrounded by farms. It's going to be growing, and Dr. Cadleb was looking for a partner.
Okay.
So I joined him.
Good. And how big population was? What was the population?
3,500.
3,577 people.
Yeah.
Can't imagine that.
Yeah.
And Dr. Cadleb was the only doctor in town.
At that time, he was. Yeah.
Yes. And how did he? What was his mode of practice, and how did he practice medicine?
Well, he was a very dedicated doctor. He was on call 24/7. His practice was unique because it was a walk-in practice, no appointments. And he ran everything himself, was well-trained. He just needed a partner. So that's the practice that I joined.
Yeah.
So we did house calls. I enjoyed house calls. 24/7, he and I were on call. You would call me at night. I would come out to see you. We carried injectable medicine with us. We could give you injections for a bad headache or abdominal pain, or even if you had mild congestive heart failure, we could give you a diuretic. So we carried significant medicine with us at that time in our house calls. Farm calls I was really enjoyed seeing farm families.
Okay.
Yeah.
So then you went into practice on your own.
Yes. So my practice with Dr. Cadleb broke up after about 7 years. 7 months. We just didn't have the same style of practice, business disagreements, so we separated. I opened an office on the same block as Dr. Cadleb, and so I had to start from scratch and bought all my office furniture and equipment. Had to buy it used. Back then, doctors took x-rays in their own office, so I would take an x-ray and sometimes I would take that x-ray into Greeley to show a specialist if I needed advice on the x-ray. It was simple x-rays, like chest x-rays and broken limbs, things like that. So, but I had my own doc room. We developed things. I had my own receptionist, my own office nurse, and took it from there. I was solo. Now I did share call with a couple doctors in Greeley.
Okay, so you didn't have to do the 24/7
No.
as much. Yeah.
But yeah.
What was the address of your office? It was next
413 Main.
Next to the veterinarian clinic.
Yes, right next to the vet clinic. And so a funny story about that was, speaking of x-rays, Dr. Jones, the veterinarian, brought over a German Shepherd because his x-ray machine was down, and I x-rayed his German Shepherd on my machine. So that was our partnership back then.
And then Dr. Cadleb's office was, do you remember the address of it?
It was in the 400 block. It was just a
where
few doors down.
Spoke's bike shop is now.
Yeah, right.
Yeah.
Yeah.
So, all right. And then you practiced. What changes have you seen in the way family physicians and doctors were? I mean, you could set bones. I know Dr. Cadleb did an x-ray and set my son's bone right there in his office when he was his first grade. And were you able to do things that they now send you off to specialists for?
Yes, yes. My career spanned 40 years in Windsor, so I saw a lot of changes.
Yeah.
Back then, we were trained to set broken bones, repair lacerations, deliver babies. I delivered quite a few babies from women in Windsor. And we did all that, and it was fun. It was really, I call it the glory days of family medicine, because we were, we had a lot of responsibility. We had our own hospital practice, so we took care of our own patients in the hospital.
Wow.
Mm-hmm. So my schedule was to make hospital rounds at 6:30 in the morning, and office started at 8:30. So that was the schedule. So we had quite a bit of responsibility, and it was just a lot of fun practicing. Over the years, as more and more specialists came in and technology came in, we just basically gave up a certain amount of privileges and care that specialists would take over. And so today, you don't see house calls anymore. I brought my bag just to show you what I would show up at your house with my bag. This was not the bag that I used. This is a bag I think may have been from Dr. Sabin.
And you might need to hold it up a little higher. I moved my camera. Go ahead.
Right, but I'm just going to show you. I'd show up at your house with a bag like this, or mine was bigger. But I want to show you some of the primitive medicine that we practiced back in the 70s.
Primitive.
This was used to puncture earlobes, for
Piercing
ears. Sorry, yeah, it was my ear piercing instrument. Actually, it belonged to Dr. Cadlam. I thought it was pretty crude, but it worked. So that was ear piercing, and then I wanted to show you. I took care of Dr. Sabin until he expired. He was in the nursing home for the last few years of his life. And Dr. Sabin left me whatever was left from his practice. And part of this is a bunch of old medicine. I mean, I have so many bottles like this that he would have. And he, back in that day, the doctors were the pharmacists. I mean, they carried just about any common medicine that you now have to go to the pharmacy for. So I just brought those to show you. And I also brought a can of ether. Back then, surgery was done with ether, and doctors like Dr. Cadlam would probably, when he was setting a bone, could, maybe have some person, use this to help them relax.
You want to open and show us? Oh, it comes in a box or what? Yeah.
Yeah, no, that's just, it's not the way you give it, but that's the way it was supplied. So I have a number of nice memorabilia and old medicines that Dr. Sabin used quite a bit. We didn't with Dr. Cadlam so much, but back in Dr. Sabin's day, yeah, they were the local pharmacist.
I know, and we're doing the interview, I should probably mention, here at the Windsor Depot Museum, and behind us is a picture of Dr. Sabin, and maybe a glare, but what do you remember about him when you cared for him? He died in 1990, it says. Dr.
Sabin, it was sad because he had he had a lot of pain. He had a peripheral vascular disease which caused a lot of pain. He couldn't walk, but he was sharp as ever. Never lost any of his cognition, and up until the end. Up until the end. Yeah.
And his office was on Main Street. In his home, or also at the hospital, or what do you remember about that?
We did have a hospital in town back in the day, and I don't know exactly where he practiced.
Okay.
Yeah.
Yeah. And who was Mildred Sabin? People often hear about Mildred.
Mildred was his sister, and she outlived him. Was a member of the United Methodist Church in town, where Marilyn and I are members still.
Yeah. And so. Dr. Sabin, did he give you any sage advice as a new doctor in town, or did he?
No, not so much. I mean, he was pretty disabled
by that time
when I saw him.
Yeah. So, of the changes you've seen in doctoring and hospital care and care of patients, what would you say has been an advancement, and what would you say you would miss as a doctor in your
Mhm.
40 years of practice.
Yeah. Well, technology has helped a lot. I mean, we have CAT scans and MRIs, and we have many more ways to make accurate diagnoses. Record keeping has progressed a lot. As you know, it's all on computers now, and it allows much more detail and complete records. The downside for physicians is you have to spend the time to do it, and it really takes a lot of time away from your practice. So that, just that technology and the requirement of physicians to spend so much more time documenting in the office and in the hospital has caused premature retirement of a number of doctors. Just did not want to put up with that much stress. We just wanted to be doctors and see patients, but our medical records back then, they were pretty basic. You had to read a doctor's handwriting, which wasn't the easiest thing to do.
I think I have some right here. Yeah, so it's true, they would do that,
But in private practice, as far as payment, I think office calls back then were maybe $25.
Wow.
Yeah, $25. And we would accept payment from patients in terms of, one time I had a patient who just gave me a cord of firewood. So we would accept trade and discounts, and we could manage our own office that way. But as time goes on, and I mean, I've progressed over 40 years. I've gone from my solo practice to partnership and increasing the number of partners. And by the time I retired, I was in my 6th medical office.
Wow.
Yeah. So and I retired from a corporation, UC Health, that when you are owned by a corporation, you don't have the freedom to share your practice with your patients. You can't share a cord of wood or a couple dozen eggs for an office visit. That doesn't work.
Yeah.
Yeah. So as the way medicine has progressed, we've lost house calls. Specialists are now, well, when I was in training in Greeley, in my residency, the residents were the ER doctors. We were the ER physicians. Not anymore. We have quality residency trained ER physicians now. So the quality of care is overall better in that respect, but I think a lot of the personal attention and personal care has been lost. And we all know we have people who are just so frustrated with having to go through the system of referrals and fighting insurance, and yeah, it's a big change.
I bet. Well, you did 40 years of service. What was one of your favorite or most bizarre situations that you had to respond to, or?
Yeah, that's a good question. I think emergency visits at a farm, for instance, out of town. I just think the number of times. Oh well, I'll tell you one thing that was interesting. The police department in town hired me to come to the police department and draw blood alcohol levels. Oh. So they would have people that they wanted to prove that they were intoxicated. At night, they'll call me at 10 or 11 at night, and I'd hop out of bed, and I'd go to the police department and draw blood alcohol. Those were kind of unique. That stopped after a while. I also worked part-time for Kodak, and that was interesting. Back in the day, they hired part-time physicians because they had a full medical department. So, yeah, and you asked interesting medical experiences. Probably the one interesting one was a home delivery that I did do in Windsor. I was surprised that I didn't have to do more home deliveries. Living 25 minutes away from the OB department at North Colorado Medical Center in Greeley. but that was a good one. And that person had plenty of children at that time, and I called the local medics, the PAs from town, and the ambulance crew would come out, and they were younger men, and they were really excited that they got to be part of a home delivery and help with the baby. So, home delivery.
Home delivery, that would, yes, people would imagine that.
Yeah.
In 1977, we did not have a formal EMT or fire department. It was all volunteers. So how did that affect did you get calls that would have never normally gone to EMTs, or?
Probably, I wouldn't know.
You would know,
Yeah. Yeah.
So, all right. Let's talk about you as a kid. What made you want to be a doctor, or where did you grow up, and your little backstory for that, Rob?
Yeah. I thought I might want to be a doctor when I was in 6th grade.
Okay.
So I kept that in my mind, ever since. I knew I wanted to be in a service profession. I actually thought about being a preacher, or but I decided I didn't want to give sermons, so I left that out. But I had read about doctors who had done missionary work, and that inspired me. So I kept that in my mind all the way through college, and all the way through college, majored in biology, and decided I didn't want to work in a research lab. That wasn't me. I'm all about people. The thing I like about family medicine is that I relate to people. And the other thing is that variety is the spice of life. That's me. So family medicine, because of the variety. When I went to medical school, I thought I might want to be a pediatrician, because I love kids. But after I saw pediatricians, the limited practice that they're able to give versus taking care of everybody from birth to death, all ages, so much more variety in family medicine. So that's what I really enjoyed. Another part of my career was short-term medical mission trips.
I knew that, yes.
Yeah. And my wife, Marilyn, is an RN, and we would go on medical mission trips sponsored by the Methodist Church. And we did 3 trips to Central Africa, Democratic Republic of Congo. Love African people, just really enjoyed them. But we were also, I would say we were on three-week medical mission trips to a number of countries around the world, and just love that part of the practice. Okay. So that's sort of what got me into medicine, and kept me going.
So you grew up with a heart for service. Where were you born and grew up?
I was born in Upper Arlington, Ohio, which is a suburb of Columbus.
Okay.
Yeah.
And you can tell us how old you are. You don't have to say your date of birth presently.
Well, I'll be 78 in 2 months.
In 2 months?
Okay.
Yeah.
So, but yeah, Upper Arlington, Ohio, which was football country. Ohio State, okay? And the stadium was only a couple miles from my house, so that's how close we were. And I still remember the biggest disappointment in my life was not making the 8th grade football team. We had tryouts, and I didn't make it. So football was the life, for kids growing up in Ohio.
Yeah. Well, you've been a wonderful member of Windsor's community and given so much. Is there anything else that you would like to talk about or tell us about as far as life as a doctor, or things that people who listen to this may not realize?
Well, life as a doctor, you commit your life to serving others, and it requires a lot of time to really be dedicated. Requires a lot of time, and so you have to be able to balance your time between your practice and your family and your community. And I think I was reasonably successful about that over my career. I feel good about that. But that's part of being a doctor, because it's a profession that you have to really dedicate your life to. So managing that with a private life is one of the challenges of being a doctor and family physician for sure. But yeah, I wouldn't trade being a family physician for any other specialty in medicine. And I've just, it's just been a great career.
Well, you've been a great addition and a wonderful service, and we thank your wife, Marilyn, and your family, too, for allowing you to do that service for our community.
Yeah, enjoy it.